Good afternoon, everybody. Today, I would like to introduce you to D-Kimia. D-Kimia is the first spin-off company from the American University in Cairo. Kimia developed a platform for accurate but low-cost detection of hepatitis C virus. Before I start my presentation, I would like to thank United Nations Foundation for inviting me to speak to you today. I would like to thank also the National Academy of Scientific Research and Technology in Egypt for supporting my activities, and the Texas Christian University in Fort Worth for supporting my research. And also, I'd like to recognize my team of researcher and engineer, Hiba Osman, and Iman Bahauddin, and Isra Bassam, and Salma Tammam, and Ali Magdi. And also, I'd like to recognize my co-founder of D-Kimia, Dr. Karim Hussein. Hepatitis C virus is a global epidemic. Almost 80 million people around the globe are chronically infected with hepatitis C virus. Unfortunately, in Egypt, we have the highest prevalence of hepatitis C virus, and approximately 1 in 5 Egyptians has been exposed to hepatitis C. Almost 80% of those who have the virus do not know they have it because it shows no specific symptoms. Also, it is important to diagnose the patient so we know who is positive and who is negative in order to perform the proper medical intervention. But unfortunately, diagnosis is both costly and complicated. Hepatitis C virus is a blood-borne pathogen, so it transfers via blood, like blood transfusion in blood banks. It is a global epidemic, as I mentioned. Infection with hepatitis C, almost 80% of patients who acquire the virus will develop chronic liver disease or chronic hepatitis, and some of them will develop to cirrhosis and end-stage liver disease or liver cancer, which are really serious medical consequences, and some of them may require liver transplantation. D-Kimia developed a platform, integrated platform for detection of hepatitis C virus RNA. This platform is a low cost, almost 25% of current technologies in the market. And the key here that we use components from the market that are already at mass production. So they are very inexpensive. And that's why we use them to assemble them in our solution, either the chemical reagent solution as well as the robotic system that we build. Our system is also compact and can be you put in a car and can be mobilized for detection of hepatitis C virus in remote location. Finally, this is an open platform, which means that we can slightly adjust or tailor our platform for detection of other viruses. And in the next slide, I will show you how can we do this. And finally, accuracy is important. We cannot develop any medical solution, any diagnostic system without worrying about accuracy. Our system produces similar or even better accuracy than a solution in the market. The integrated solution consists of 3 steps. Step number 1 is the automated extraction of hepatitis C virus RNA from blood. And this is using a robotic system that we built that performs 5 basic lab functions. And it relies on the utilization of magnetic nanoparticle for recognition of hepatitis C virus RNA. The second step that we use this purified RNA, we amplify it using a chemical reaction called real-time PCR. And then finally, we use a low-cost thermal cycler for detection of this virus. We have already done alpha testing on part 1 and part 2, over 500 of patients with chronic hepatitis C virus, and the result, again, is similar or better than similar system. And we have been approved and received support to develop our own thermal cycler, which is a second automated system that we developed in D-Kimia. This is a photographic or a graphical representation of the previous slide. So we start by extraction of RNA using magnetic nanoparticle. On the surface of magnetic nanoparticle, there is a biological moiety that recognizes hepatitis C virus and take it out of the blood. And then we use the robotic system down there that does a complete automated process in order to extract RNA, which will be of high quality and high purity, which will guarantee the accuracy of the downstream process. In the second step, we amplified RNA of the hepatitis C virus to a very large number. And then finally, we use a thermal cycler for detection of the HCV. And then we report the viral load or how many viral particles in the blood of the patient to physician. We aim to use this integrated platform to support the national initiative in Egypt to screen 45 million Egyptians, 4 million of whom are expected to have the virus and will require HCV RNA test. We also would like to support the community-led initiative dubbed Educate, Test, and Treat, where scientists will go or physicians will go to an entire village and screen this entire village for the virus and treat everyone. So we'll make sure that this village is totally hepatitis C virus clear. We will enable triple the number of patients due to the low cost to be detected earlier to avoid further medical complications like end-stage liver disease, cirrhosis, and liver cancer, and need for liver transplantation using existing resources. So we have lowered barrier to health. So when we lower the cost, we allow more patients to be tested, allow a larger number of the population to be recognized. Second, we will reduce mortality due to hepatitis C virus, which is currently estimated at 50,000 deaths per year. And then finally, we can reduce new transmission and viral spread. Finally, what are our next steps? Number one, we're looking for partnership for industrial large-scale production of the robotic system that we have developed. We are also looking for support to help us to do beta. We have done alpha testing, generated excellent results. We need to go beta testing in other hospitals for both kits, for the extraction and the amplification kits. And then finally, we would like to receive support to acquire health regulatory approval in order to be able to reach the market. Thank you very much.
Amazing. That was fabulous.
Thank you. Thank
okay,
you
acceleration partners, come on up. So every entrepreneur needs a network, and needs a network of colleagues, peers, friends, teammates, et cetera, who will help them. So 3 folks are going to role model this, and they're going to give some feedback really quickly of things we might add to the mix. Nina, awesome. Introduce yourself.
My name is Nina Sharma. I'm the managing director at Project Excite, which is the innovation program at the University of Denver. So I come here with a university hat on. I think this is amazing. I think we've done is great. And I don't know if you mentioned it, but this is the first company to be spun out of the American University in Cairo, which I think is amazing.
This is really important. This is, again, the first company to be spun out of the American University of Cairo. All of our innovators in the universities have great inventions that could come to market in different forms, nonprofit, for-profit. So this is an amazing result. Congratulations.
Yeah, I think it's something that's pretty revolutionary, and I think you can spread this and spread how you've done this to other universities, and we'd be happy to help or consult and partner with you guys on that.
Thank you.
Thank you very much. Again, yeah, pretty revolutionary technology, and I think one thing to note is really the universality of this technology. We talked about its application to hepatitis C, but there's also the same principles and technology can be used to, you know, a real sort of universality of diseases. So on that note, I think, as a quick introduction, I got too excited. My name's Shankari. I'm the Director of Strategy and Partnerships at Unreasonable Group. And what we do is help divert resources towards the world's most pressing problems. So would love to help you in terms of industrial partnerships, potentially with medical device and innovation companies, as well as some different clinical research companies to really help get through those regulatory barriers and industrial production barriers as well.
And you guys are in the same wavelength, because I know you had lots of ideas like that, so exactly
Absolutely.
the kinds of wider application. Mo.
Hello, everyone. Matalani from Startup Bootcamp, AfriTech. And we ran a 3-month accelerator period, a Pan-African accelerator, and it's great that you're in Egypt because, you know, Africa is doing great things. This is the first time we're seeing a startup that is in, like, actual hardware medical devices, and it's exciting for us to be able to partner with you to take it through the lean methodology, and I think this can help. We can help you in like connecting with other thought leaders and innovative spaces that can actually help advance your solution from concept to market.
Yeah, so amazing result. And again, thinking about the network, universities that are working together to accelerate entrepreneurs on campus and engage students in the awesome real world of solution making right during their classes. 2 kinds of accelerators, both programmatic with Unreasonable, that's also physical, and you guys with AfriTech and Startup Bootcamp, really coaching and using months, not years, to accelerate these fabulous entrepreneurs. So thank you very much. Thank you. Okay, thanks everybody. you.